we're looking to create programs, we're looking to create partnerships that provide that voice to be that active participant. Now, with that in mind, depending upon the culture, sometimes you don't feel comfortable being that active participant. You don't know how to be an active participant. And more importantly, sometimes you don't think you can ask a question. So we're trying to break down those barriers and have that conversation. And more importantly, pull in from the community, because it is the community that is critically important in establishing trust.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Within 840 miles of coastline, forests, mountains, and valleys reside over 39 million people and the fifth largest economy in the world. California is almost more like a country than it is a state. And with these colossal proportions come many responsibilities. Most importantly of all, it's public health. Hello, and welcome back to the first episode of the fall season of our Health Technology Podcast. I'm joined today by the remarkable Dr. Diana Ramos, our very own California Surgeon General. Dr. Ramos was appointed by Governor Gavin Newsom in August of 2022. She brings over 3 decades of experience in public health with a strong focus on health equity and reproductive health, and is the first Latina to hold this position. Born and raised in Los Angeles, Dr. Ramos has driven change through various roles, including Public Health Administrator at the California Department of Public Health and Director of Reproductive Health in Los Angeles County. In this episode, you will learn about Dr. Ramos's journey from a single-parent household to leading public health initiatives. She shares her insights on the importance of maternal and mental health, addressing adverse childhood experiences, her current initiatives as Surgeon General, and offers valuable perspectives on improving public health outcomes. Enjoy our conversation, and again, welcome back to the Health Technology Podcast. Welcome, Dr. Ramos. Thank you for joining me today.
Thank you so much, Christine. Such an honor to be here to spend some time with you.
Yeah, I've been looking forward to this conversation. I know you gave a talk at our past symposium in May, and I want to make a bigger audience in our podcast community to hear more about your story and your initiative and the impact that you want to make through your role at the California Surgeon General. And we like to share the story about your journey and what take you to where you are today.
Sure. I would love to share. So I was born and raised in Los Angeles, and I was raised by a single mom who came from Mexico when she was 16 years old in search of a better life. And my mom would work up to 3 jobs to make sure that she can give me the resources that she never had. And I will be indebted for my mom for forever for having that vision. But it was her vision that an education was the best gift that she can give me. She said, I will die and leave you nothing, but the one thing that no one could ever take away from you will be your education. So that always stood, in the back of my mind, and wanted to be a doctor, and seeing the people who took care of me, who took care of my cousin who was often sick, and realized that, wow, a doctor can give back, and would love to be that one day. So I oftentimes tell students when I speak to them that if you were to look at the word nerd in the dictionary, you probably would see my face, because I had braces and I had braids, and, I was pretty homey looking. But that was the best investment of myself, was in education. And I subsequently went to USC undergrad with a communications degree, graduated from there, and then eventually went to USC medical school. I guess it was 9/11. I was working at the time for Pfizer Pharmaceuticals and had the opportunity to go down to ground zero and to provide medical care for what we thought were going to be people that needed help. There was nobody there. And it was at that point that I realized I wanted my life to be much more impactful. And that's when I pivoted to public health and went on to get a master's in public health from UCLA and realized, wow, you can really make a bigger difference, see more patients, impact more patients than I could as a physician, seeing one patient at a time. Eventually, then I went, worked for LA County, Director of Reproductive Health, and realized, wow, social determinants of health, creating programs for prevention can really make an impact. And I subsequently went on to the California Department of Public Health and was later asked to if I was interested in applying for California Surgeon General. And here I am standing before you. I did get a master's in business administration and MBA from the UCI Paul Merage School of Business because I thought, wow, the way to really impact the world would be through business, through innovation, through AI. And I focused on gaming. And I saw how gaming could really provide the education information that somebody could use in a fun way. When I saw my son playing Minecraft and my mom playing Candy Crush, I thought, why can't we do something that can they can walk away with education? So that takes me, that gives you a little brief synopsis of my journey as to how I'm here. And for those of your listeners that are, I know there's entrepreneurs, there are business people, please know that what you're doing is can help direct and change the future of how medicine is provided. So thank you.
Well, that is quite a story, and you're a good example of the American dream to your having your mother as an immigrant and the success that you achieve and also the giving back that you give back to our community. And I thought your story, you went to all these different schools kind of prepared to what you're doing right now. Is like, do you have this foresight this is where you're going to be?
Yeah, that's a great question. And the answer is no. And so, looking back and when I speak to students and young physicians, I remind them that sometimes life takes you on a path that you really don't understand what the final path will look like until you look back. So as an undergrad, when I was a communication major, I would have never thought that those skills that I learned as a communication major would be critically important in my position now. And so, and the public health degree, I live the social determinants of health. I live the adverse childhood experiences. So to be able to speak to those topics from a lived experience really, I think, makes the difference and makes me a better advocate to say, look, I know what the people we're trying to help are going through.
Yeah, one of the things that I think it would be also interesting for all our listeners, even for me, is that, we hear about California Surgeon General and then the U.S. Surgeon General. And tell us about what is the role of California Surgeon General and how is your role impacting the health of Californians?
Yes, so the role of the California Surgeon General was created in 2019. And that was created by Governor Newsom with the understanding that some of the pernicious but least addressed health challenges are the upstream factors that can become chronic and acute conditions and eventually in the long run are more difficult to treat. So it was recently created, and just to make you aware, there are only 4 other surgeon generals in the country. So not every state has a surgeon general. And this is something that I would like to challenge all the other states. I mean, everybody has an attorney general, right? But very few have a surgeon general. And I believe that codifies the importance that the Governor Newsom has in prioritizing health. And so health should be a priority for every state, right? And so the role focuses on advancing the health and the well-being of all Californians. And really, we focus on key topics. So for me right now, the priorities are reproductive and maternal health, mental health and well-being, and adverse childhood experiences. So, and I'm a voice. I'm a voice to the public. I'm a voice of education and awareness. Somebody, especially when I do some Spanish segments, to be able to say in Spanish, what the information is, and here are the resources. And then more importantly, let them decide the next steps for those people. I am the trusted health voice that many of our partners have been using, and I'm happy to continue being that voice of public health, of insight, and really providing that trust that has been unfortunately eroded over the past few years.
That's my next question, actually, that you kind of briefly mentioned it. How do you gain that trust? Because I think it's so important in order to improve the well-being of everybody.
So I don't know that there is one sure way. It's multifactorial, multi-pronged. And I think, we've done some focus groups. We've done some informed interviews on trust. And some of the messages that we hear is that the other person who we're trying to establish trust with, they need to be an active participant. So with that in mind, we're looking to create programs. We're looking to create partnerships that provide that voice to be that active participant. Now, with that in mind, depending upon the culture, sometimes you don't feel comfortable being that active participant. You don't know how to be an active participant. And more importantly, sometimes you don't think you can ask a question. So we're trying to break down those barriers and have that conversation. And more importantly, pull in from the community, because it is the community that is critically important in establishing trust. So I may be one person at the state level, but there are many community partners at the local level that can be my ambassadors to say, hey, maybe it's worth listening to her, and let's send her a question. I always welcome that. So it is really cross-collaborative with pulling in the community partners, pulling in all of the resources that are already available, and more importantly, listening to our partners at the ground.
Do you have a concrete example, and that's how you've done it and seen the result?
Yeah, so one of the examples is right now we're currently developing, it's called Prima, a patient risk in medical assessment. So maternal mortality is something that is unfortunately, California and the U.S. has one of the highest nationally and internationally as well. So that being said, one of the things that we heard from some of our focus groups is we want to have a say in our health. With that in mind, and as an OBGYN, I took care of patients. And unfortunately, it wasn't until that first prenatal care appointment when they came in and I looked at their history and I had that first visit that I would tell them, wow, it looks like you're going to need a C-section because of XYZ, and you may be higher risk because of XYZ. Though what we're developing right now, Prima, is actually providing that information of potential high risk before a person becomes pregnant. So we're taking it outside of the healthcare setting and we are putting it in the community, in the consumer side, and providing the information. So right now we're in the process of validating our 7 questions. And based upon the responses, we can give a general assessment to say, based upon your responses, you may be high risk, and these are the things you may need to do, or average risk, and provide them to resources. The beauty about this is that it is based on already validated questionnaire, the OB Health Index, that Dr. Brian Bateman developed when he was at the Brigham. And it can predict, it has, I think, 97% predictability, sensitivity, that somebody may need an ICU admission, somebody may be a high risk admission. So we're taking those risks and putting that in simple terms in information that can help the general public assess their risk. So we're excited. Dr. Cesar Padilla from Stanford and Susan Perez from UC Davis are our lead investigators. And we hope to be releasing this soon. But this will be a game changer. This will now provide that awareness, that ability to have a voice, to ask questions about people's health. And that's what we want, is we want people to feel like they can ask questions, feel like they are that, that active participant. But more importantly, we're going to be leaning on our community health workers, on our promotoras, on our doulas, to be that bridge of that trusted local person, and hopefully let people know, it's okay. It's okay to do this. And the simplest analogy that I can share about our Prima survey is when back in the day when there used to be Cosmo magazine quizzes, you would answer your 5-6 questions, and based on your responses, your relationship is likely to work, or no, your relationship's not going to work, right? I don't know, for those of us who are old enough. And so that's what this is putting it out there and saying, based upon your responses, this is what, could happen, but here's where you can go for more information.
Yeah, no, I think I'm so glad to hear that there's a lot more interest in prevention. I guess what I'm saying is like taking care of them early rather than when they're sicker and harder to treat. And I think that's oftentimes we don't pay attention to much of it. At least in healthcare, we always focus on treating people rather than keep them healthy.
Right. We need to leverage both the public health prevention aspect, and when folks need it, provide the care that they need to help them get healthier and better.
Yeah, you mentioned about the reproductive health and different initiative. As a Surgeon General, I'm sure you see so many areas that need attention. And can you share your process on how you identify these other priorities that you're going to focus on during a certain period of time? Because there's so many challenges, but how do you pick this few that
right.
focus on?
So the easiest one is the adverse childhood experiences. And I say that easiest because that's what's codified in the statute into the position. So I have to focus on that. But that's not to say that I can't focus on a different aspect of it. So the first Surgeon General was a pediatrician, and the focus was primarily on adverse childhood experiences. And I'm an OBGYN, obstetrician gynecologist of women's health. And in speaking with Dr. Vincent Folletti, who is the lead researcher on the whole adverse childhood experiences, I realized, wow, it starts in adults. And you have a 2-for-1 if you focus on adverse childhood experiences in the mom. Then she will be healthier. She'll be a better mom, a better caretaker for the baby, and the baby will be on a more positive trajectory. What sometimes folks forget is that one of the adverse childhood experiences includes mental health. And so oftentimes, moms have depression, anxiety disorders. And so if we can help mom during pregnancy, then later on, she'll be more likely to pay attention to the baby, take care of herself, and it's the whole family as well. So as an OBGYN, I'm focusing on the adverse childhood experiences, bringing it back to the adult emphasis, taking advantage of the fact that we can get a 2-for-1 with reproductive age people, and continuing the work that was started in the pediatric realm. And the other focus, the perinatal maternal mortality program, and the focus is because I'm an OBGYN. So I've been doing this my entire career, focusing on quality improvement for women's health. So it was the lowest hanging fruit for me. And when you think about maternal mortality, you have to really think beyond just pregnancy, because we know that it is the health before a person becomes pregnant that impacts the pregnancy. And then the fact that maternal, your health during pregnancy is a stress test for what your health will be like after delivery. So if somebody goes into pregnancy with high blood pressure, they're higher risk for having preeclampsia. If somebody goes and has preeclampsia during pregnancy, they're higher risk for continuing to have high blood pressure after delivery. Diabetes, if you are gestational diabetic in pregnancy, you're at higher risk for having diabetes after delivery. So it's a whole continuum of care. And so we just saw this as the opportunity to, wow, this is the lowest hanging fruit, and it's the whole life course. And we are all impacted by our health before, during, and after. And I say we because it's not just the mom, but it is the children, the offspring. It's everyone's health.
I think at least for me, it feels like it makes total sense. It's almost like those are the foundation of the fabric of how our population grows, from the taking care of them, like the mom and then the child. That's kind of, in a way, can predict what that future looks like when you have a good childhood.
Absolutely.
Right.
Yes.
One of the things that you mentioned about reproductive and maternal health, and you're mentioning a little bit about the Prima. What are some of your major initiatives in that?
Yeah, so we're calling it Strong Start and Beyond. So I would invite folks to go to our website and see some more information. We would gladly welcome you as a volunteer. So anyone who wants to help us promote our initiatives, please, this is a selfless plug for volunteers. Please go to our website and look up the Strong Start and Beyond initiative. And really what we are trying to do is to make sure that everyone has that best start. We know that 80% of maternal deaths are preventable. 80%. So, bringing in the public, bringing in the partners, bringing in tech is so critically important. And I say tech because this is a flip on how public health has been delivered. In the past, public health had been focused on putting out a flyer, inviting people to events. What we're doing is that we are partnering with those who already have, whether it's an app, whether it's a website, a program, and we're providing the resources to them so that they can then, so that anyone that comes to your website or on your app can see, oh, here's something from the Office of the Surgeon General, the California Office of the Surgeon General. Let me click on it, and it's the Prima, right? And then they start to get more information and they can help themselves. So yeah, lots of opportunities for cross collaboration, for implementation, and we're promoting other programs that can help support them as well. So it could be that app that you've created, that the website that houses your program that you've created could provide the resources to help them be healthier. So it is the way that we see it. We're trying to promote our partners and continue our cross collaboration.
Tell us more about, like you mentioned about, we're always looking for volunteer. What does that mean? Like, what kind of volunteer? You mentioned about having your information in their app, but is that? I'm sure there's more to it?
Sure. The simplest is just to promote the fact, one, it's the fact that maternal mortality can be prevented, to help us be that messenger. If your audience has a connection with the Black population, the Native American population, and I highlight these in particular because we know that there are disproportionately more negative health outcomes in these populations, especially in moms, than the other populations in terms of death, in terms of just basic health outcomes. To be that messenger and to say, hey, there's this information that is on the California Office of Surgeon General that you may want to look at. And because it's coming from them, then the public may be more apt to take a look. If there are resources in the community that folks live in that can provide the care, whether it is healthcare or whether it's a community program that will help support whatever the mental health needs are, or we know that risk factors to high blood pressure are obesity, are smoking. So if there are programs in your community that help address some of these, I'd love to elevate that. That's what I mean by partnership. It's just to let us know what is in your community, what resources you have, so that folks can know and we can elevate the work that's being done locally.
Sounds good. And for those who want to volunteer, where and who should they contact?
They should go on our website, The Strong Start and Beyond. You could Google it. And, we welcome everyone and anyone. Yeah. I believe it's at the top of our website, the California Office of Surgeon General.
And so you're trying to implement all these initiatives. How do you measure your whether it's having traction, and do you measure it over a period of time?
So our it's over time, but we have some concrete outcomes, concrete measurements. So for the adverse childhood experiences, we work in collaboration with the Department of Healthcare Services, and they have the billing codes. They have the billing codes for the adverse childhood experiences screening. California is the only state that will reimburse Medi-Cal providers $29 for screening for ACEs. And so the billing codes are there, and we know exactly not only how many people are billing, who's billing, and the other metric is taking the ACEs Aware course. That is a requirement in order to be able to bill for the ACEs screening. So those are the metrics there. In terms of the maternal mortality work, the Strong Start and Beyond, that's getting started, but our metrics are obviously going to be looking at maternal deaths and looking at the morbidity. So that's going to be long-term because of the fact that maternal mortality, thankfully, is not so common. We're going to, we need a longer block of time in order to measure our outcomes.
And so that then it was kind of like the lagging indicator. How do you know that this is the right strategy? Because sometimes you don't want to wait that long to see like, okay, is this the right track?
Yeah. So one of the things that we are doing is that we are not creating any new programs. There are lots of programs already created by the American Heart Association, by CDC, by, many organizations focusing on this initiative. And so what we're doing is that we're elevating, because there's so much work that's being done. Oftentimes folks don't know. We all work in parallel. We all work in silos. They don't know that, wow, I didn't realize there's 5 other partners doing very similar work in our city. And so we're not creating anything new there. For an example is the California Maternal Quality Care Collaborative was recently funded by HRSA, a multi-million-dollar grant that really pulls in statewide partners on decreasing maternal mortality and morbidity. We're inserting our initiative into what they're doing already. And they're already reporting all of the metrics and outcomes to HRSA already. We're doing very similar collaboration with Charles Drew, who is focusing on Black moms, and in particular with community health workers, expanding that workforce. And then we're partnering also with Los Angeles County. They received a HRSA grant for maternal depression. So they all are capturing the data. They're all capturing the outcomes. What we're doing is that we're making all three funders aware of, wow, look, you're all doing amazing work to decrease maternal mortality and improve the health of mothers. Let's come together and not only understand what you're doing, but more importantly, expand and replicate what you're doing throughout California. So that's how we leverage our partnerships and measure our success. They're already being required to measure all of their outcomes to their funders. We just bring them all together and hopefully we'll replicate one initiative throughout California.
It sounded more that you have that role to convene different group organizations that are currently doing something in that particular, that focus in the initiative that you're focusing on, and make them aware and have them work each other. Hopefully their impact will get bigger.
Absolutely. And sometimes too, they don't realize that, oh, well, you mean the tech initiative that I just am working on can actually help decrease maternal mortality? Yes. So making folks aware, look, we can leverage what you're doing to have a bigger impact than just the one thing that you thought your app was going to be focusing on. It could actually do a lot more.
Yeah. You mentioned earlier about volunteer of your different organizations, but as Californian, as regular, citizen, what can we do to support the initiative to make California a healthier place to live?
Yes, no, thank you. So I think one of the most important things to focus on is the fact that there's a lot that's happening locally, and to understand what is happening locally and be an active participant, and more importantly, help direct. So an example would be mental health is a critically important issue, and many folks don't have access to a healthcare provider immediately. But what I see happening is that there are places of worship that are promoting and that are establishing mental health support groups. So to be able to, one, be aware of what's happening in your community, and then be the support for somebody that may need that mental health support is going to be critically important. That's just one piece. I think the most important thing is to increase awareness, education on health. So going forward, there's not one solution, one recommendation. It really is multifactorial, depending upon where you are, where you live, your access to resources. I was on a call earlier today where I was reminded that in many Native populations in many areas in the Central Valley, there is no Wi-Fi. There is no availability to communicate. And so what are some solutions that we can come up with as a community to help address some of these needs? And I think it's the locals who live in these tech deserts that can come up with the best solutions that we can elevate and share with others.
Yeah, we definitely take it for granted. We assume everybody have Wi-Fi access. One last question before we conclude. I know you're short on time. What are the surprises that you did not foresee when you took the job as California Surgeon General?
The biggest surprise was the impact that I would have on others as a person. And so what I mean by that is I did not realize that by being a Latina, bilingual child of an immigrant, that I would be a positive role model and make a big impact on others. So I have met several college students, medical students, high school students, residents who have said, Doctora, I cannot believe that there is somebody that looks like us that is in your position. I never thought it was possible. And I thought, wow, okay, if my whole purpose of being in this position is to be that role model, then that has been the biggest gift to me.
Okay, wow. That's great. And I'm sure that must be very touching and rewarding at the same time when you hear that.
Absolutely, especially when some of the students that have said that to me, they're crying and they said, I know that what I'm doing is possible and I one day want to be like you. And I say, wow, fantastic. I'm looking forward to finding my replacement.
Yeah, I think it's the power of hope. I think that you give many of these young folks is you give them hope that is possible.
Yes. The American dream, as you said earlier, Christine.
Yeah, well, that's great. Well, thank you so much for sharing with us your story as well as the work that you're doing. And I'm very excited to see the impact that you've accomplished.
Thank you so much for the time and the opportunity, and looking forward to collaborating with your audience and uplifting the work that they're doing.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.